Well, the winter season brings in cool temperatures, even some ice and snow.
And it's important to know how cold weather can affect your heart, especially if you have cardiovascular disease.
Jane Thayer, Director of Transplant Services for Baptist Memphis, is here to discuss how you can take care of your heart in cold weather. You know, I didn't have well, first of all, welcome.
Thank you very much. It's a pleasure to be here.
You think about overdoing it and things, but you don't necessarily always think about the cold temperature-wise having an impact on your heart. So what are the impacts?
Well, the impacts are that your body has to work hard to maintain its internal temperature. So the body is pumping harder, and if you already have cardiovascular disease, it has a detrimental effect. It raises your blood pressure, puts extra pressure on your heart, so that's not good. You have to know how to taper your activities during the really cold weather when you're outside and very active.
And you know, that's really true, especially for athletes. What are some tips that you can give us to help us stay warm and protect our heart at the same time?
Well, if you're outside either performing a sports activity or working, you can take frequent rests. You can dress in layers of clothing, which will provide insulation and keep your body warmer. Do not drink alcohol before going outside, because this can give you a sensation of warmth and you won't know that your temperature is really much colder, and it can steal the warmth from your internal organs, putting more work on your heart. Don't eat large meals before going outside or when coming back in.
These are things that I would have never thought of.
Never thought about.
Wow.
What about hypothermia?
Hypothermia is when the body temperature falls below 95 degrees. So that's a real danger, and people can actually die from that, from heart failure. The symptoms of this would be slowed thinking, sluggishness, mental confusion, lack of coordination, shivering, and sleepiness.
Now, the cold weather can actually increase a person's risk of having a heart attack?
Yes, indeed. It's been shown by studies that more heart attacks occur in the cold months and the cold weather than any other time of year.
Now, is this really geared, these threats, for people already with pre-existing cardiovascular disease, or is this general information for anybody? Well,
the children, elderly, and those with heart disease, it's most dangerous for. Elderly can't maintain that inner body temperature as easily as others can, so it's especially important for them to take special precautions.
And if folks wanted to read, go to a website to read about, you know, how to protect your heart during the cold weather, where can they go?
The American Heart Association has an excellent site for both the public and health professionals, so it's a great place to visit.
Everybody needs to learn more about it. Thank you, Jane, for being here. For more info on how to take care of your heart in the cold weather, of course, we've got a link on our website. Head on over to localmemphis.com and click on the Find It button.